So there is light at the end of the tunnel on the fight against COVID-19 on the African continent. 2 West African countries started vaccination after receiving vaccine doses from the COVAX facility. The facility was set up by the World Health Organization with the aim of ensuring that the developing nations have access to vaccines. We're now joined by SABC News foreign editor Sophie Mokoena, who's been monitoring the COVID-19 story since the outbreak was reported, of course, there in China. A very good evening to you, Ms. Sophie. Thanks indeed for your time. Let's go to the breaking news story first. Over the past hour and a half, developments out of Zimbabwe. The second vice president resigning there. Any talk of succession yet?
Well, it is not clear yet in terms of what President Mnangagwa is going to do. But you know that in the year 1987, in December, both the ZANU-PF and the ZAPU signed what they call a unity accord. In this agreement, there was an agreement that the second vice president or one of the vice presidents of Zimbabwe will be from the ZAPU party. And therefore, we don't know whether he is going to continue with this trend or this historic trajectory. And we know that if that has to happen, he has to look for those senior members of ZAPU party. And currently, when you look at perhaps number of people who are there, the current commander, the army commander, who is Valerio Sibanda, is one person you can look at. But also don't forget SK Moyo, you know, the former Zimbabwean ambassador to South Africa. He is also a strong candidate. Perhaps some people are saying he might look at perhaps empowering women, because the ZANU-PF women's wing have been campaigning very hard to ensure that one of the VP position goes to a woman. But the question is, will that continue with the tradition of having ZAPU as part of the leadership at the presidency level? And we know that it will be a difficult one, but we're hoping that in a few days to come, we'll definitely know exactly who's going to be the vice president, because I think President Mnangagwa, this is what I spoke about a week ago when the news started around Vice President Mohadi's behavior, that President Mnangagwa will have to do something. And I am very certain that behind the scenes, that's what he has done, asking Mohadi to resign rather than firing him, as it did happen with President Thabo Mbeki in South Africa in 2005. He requested President Jacob Zuma to resign, and President Jacob Zuma was reluctant, and he finally announced that he is relieving him from his duties. And I think this is what's happening.
That's certainly a story to keep watching. Let's go to vaccines now. The COVAX facilities is beginning to bear fruit. Today was a big day on the continent. 2 West African countries starting with vaccination. Certainly something to celebrate there.
Of course, Criselda, you know very well that the World Health Organization has been working very hard to ensure that developing countries and poorer countries have access to vaccine. And today, Ghana and Ivory Coast starting this process with a vaccine that was procured by the COVAX leadership, people who are leading that facility. I think it was a good news for WHO, but also to developing countries and poorer nations. Let's take a listen at what the Director General had to say earlier on about the developments today.
Aspen is one of 7 sites globally that have been selected by
Today, Ghana and Cote d'Ivoire started vaccinating health workers against COVID-19, becoming the first countries to start vaccination campaigns with doses supplied through COVAX. A further 11 million doses will be delivered this week. Between now and the end of May, 237 million doses of vaccines will be allocated to 142 participating economies and countries in COVAX. Tomorrow, COVAX will publish the first round of allocations covering the majority of economies participating in the COVAX facility. It's encouraging to see health workers in lower income countries starting to be vaccinated. But it's regrettable that this comes almost 3 months after some of the wealthiest countries started their vaccination campaigns.
And also on Friday, it will be 1 year since South Africa reported its first COVID-19 case. I mean, how far are we in addressing the problem of COVID-19? But certainly, I'm sure a lot of strides have been made. The vaccine is here.
Yes, indeed, the vaccine is here, but we're looking also in terms of what could be the role of South Africa in ensuring that there's manufacturing of vaccine on the continent. But we know that Aspen, pharmaceutical company in PE, they have been requested by Johnson & Johnson to assist in the packaging and also the manufacturing of vaccine for Johnson & Johnson. That is going to be distributed around the continent, but also around the world. Let's take a listen at what the senior executive at Aspen had to say about the role of Aspen in ensuring that perhaps there's this small step, but a giant leap in terms of ensuring that Africa is counted amongst the regions that are manufacturing or packaging vaccines.
Aspen is one of 7 sites globally that have been selected by Johnson & Johnson, the only African company, and the way I understand it, the only one in the Southern Hemisphere selected by J&J to contract manufacture. So we're very proud of the country's scientific, technical and manufacturing capabilities. I think that's a starting point. It's a good thing. Secondly, we have indicated that we can manufacture up to 300 million doses of the J&J vaccine. It doesn't mean that J&J will take all 300 million. They might contract for a lower amount. We don't know that yet because that is an ongoing discussion. As I said, a lot of these things are fluid. The third thing is that Aspen is probably going to be J&J's biggest contract manufacturer. And J&J have indicated that this manufacturing will be for the African continent and beyond.
Ms. Sophie, turning lastly, of course, to other issues. Today was the first day of the World Trade Organization Director, Ngozi Okonjo-Iweala. I mean, reform was one of the key issues that we heard about in the run-up to all of this that should prioritize. What was the first order of business for her?
It was to interact with officials and also to attend meetings at the World Trade Organization's headquarters in Geneva. And I think she made it clear to journalists who were outside the building to see her arriving that she is going to work very hard, and also talking about the vision of the WTO. But you know that 6 months down the line, there wasn't any leader at the helm of the WTO, and therefore he's got a lot of work to do, but also to pull together the countries to agree, particularly on issues of addressing the COVID-19, on pharmaceutical companies and perhaps access to vaccine.
Absolutely. Thanks indeed for your time. Sophie Mokoena.